Hello, hi, it's Dr. Jerome Fryer. I just wanted to quickly explain to you what it means to have a sore facet joint. The facet joints are the joints that live on the back side of the spine. The disc is on the front and on the back side, and very often when you bend backwards, a sore facet will present with pain because the joint slides together. Often patients will be bent forward or even a list at times when the facet joint is irritated, or the facet capsule, which is the capsular ligament that surrounds the whole facet joint. So when you roll over in bed, you can see that the facet joints will touch one another, and that's often a pretty good indicator that it's the facet that's causing your symptoms. It can be the disc, but most often it's a facet joint. In the cervical spine, we have the same facets. You can see all along here is the articular pillar, it's called, where we actually palpate and feel. Very often you can feel over a sore facet joint with the muscles overlaying. And the same concept applies when there is specific rotation. When you rotate, the facets can touch or slide together. And if they're irritated and the subchondral bone or the capsule or the hyaline cartilage is irritated, a rotation will actually cause a little bit of discomfort. Often found in a sort of a wry neck kind of a position, facetogenic pain or pain coming from the facet is a common cause of that wry neck kind of presentation. So the different strategies, surgeons will sometimes use an injection to try and reduce the inflammation, when things are chronic and don't go away. But as chiropractors, what we also do is we do manipulation, where you actually open the facet joint to create more space, to free up. Sometimes we believe that there is a little structure in there called a synovial fold that gets entrapped as well, but the manipulation will actually create more room between those surfaces. A very common reason why facet pain occurs is when there is disc height loss. You can see that the facet spacing, joint spaced width, is going to be tighter. Or if we put a little feeler gauge in there, it would be a smaller distance between the two bony surfaces. So what that does is it increases the risk, when the disc height goes down, and increases the risk of this facet becoming irritated.